The first group of fungal infections we'll talk about are the superficial mycoses, or superficial fungal infections, that colonize the outer layer of the skin, hair, or nails. For the most part, they are not going to elicit any immune response. They just don't get into the body far enough to trigger the immune system. So really what we're talking about are infections that are mostly going to be of cosmetic concern. They have a fairly simple diagnosis and treatment. Most of the time, people can just be prescribed some sort of ointment and everything's going to be fine. So the first superficial mycosis we'll talk about, pityriasis versicolor. This is what it looks like if you do a little skin scraping. You can see kind of a little combination of yeast and more elongated forms. Here is what they look like under electron microscopy. And you can see the budding. This is budding that's occurring. Here's a larger cell with the bud beginning to form. These symptoms are caused by members of the Mycoses fur complex. And as you can see in this left image, and as I kind of pointed out to you already, they're going to be visualized as yeast-like cells with some hyphae mixed in. The majority of these superficial mycoses are going to mostly be found in warm tropical climates because they like the moisture. So, here, I don't know about you, but my skin, super dry. When I lived in South Texas where it's humid, skin was not dry. If I lived in an even more tropical climate, you've got a lot of moisture. These are not found generally as saprophytes, meaning we don't find them in the soil, and we don't usually find them on other animals. This is going to be person-to-person spread through the transfer of infected keratinous material, hair, skin, or nails. The lesions are going to be small, and what you'll see is basically differential pigmentation. They interfere with melanin, and so the presentation depends on your natural skin color. If you have naturally lighter skin, the infected spots will look dark. In patients who have naturally darker skin, the spots look light. And this can be diagnosed by microscopy of skin scrapings. So you'll see if you scraped one of the discolored areas, you'll see the yeast and the hyphal structures. Or you can try to culture it. It takes 5 to 7 days. In this case, microscopy might be easier and faster. It's not going to kill the patient to wait 5 to 7 days though either. So it's up to you as the clinician what you want to do. These are generally considered to be chronic infections. Most people don't seek treatment or don't have access to treatment. However, they can be treated with topical azoles, so like a cream. If it's in the hair, shampoo that contains selenium. Selenium is generally toxic to fungal cells. If a patient has a more systemic type of infection, like not just localized to one part of the body, but maybe all over the body, they could be prescribed oral antifungals. But again, this is not going to interfere with daily life. It's not even going to be physically irritating. It could be cosmetically irritating, though, to have these differential coloration patches on your skin, but again, won't interfere with the ability for you to function. Another type of superficial mycosis is called tinea nigra. I'm not even going to try to pronounce the species name, but as you might imagine, it causes darkening of the skin. So we see, again, a discolored pattern in the skin. And via microscopy, you can see hyphae or elongated budding cells. This is generally going to be a tropical or subtropical infection, so you probably won't see this in the States unless you've got somebody who's maybe recently immigrated or recently traveled to a tropical or subtropical area. Generally, though, this is harder to get. It requires traumatic inoculation into the superficial layers of the skin. So there has to be an injury for this to establish itself. But still, it establishes itself only in these superficial layers. It doesn't cause any sort of immune response or irritation. It's just a discoloration. But it may cause you to go into panic mode because it can resemble a malignant melanoma. Remember, with melanoma, what you're looking at is watch your moles, is what they tell you. So you're looking for something that has irregular borders, that grows pretty quickly, that wasn't there before, and now it is. But in this case, I'd be much happier to find out, oh, fungal infection, rather than a malignant melanoma. It can be diagnosed by microscopy of skin scrapings, and then you can do culture. Culture will take approximately 3 weeks, so that takes some time. And of course, it can be treated with topical therapy.